My name is Vedant Kulkarni, and I'm an attending pediatric orthopedic surgeon at Shriners Children's, Northern California. I serve as the Medical Director of Orthopedic Education and Program Director for the Shriners UC Davis Pediatric Orthopedic Surgery Fellowship. I'd like to thank the editors of Developmental Medicine and Child Neurology for the opportunity to present our recent publication entitled HipScreen, Mobile App for the Measurement of Hip Migration Percentage in Children with Cerebral Palsy. Accuracy, reliability, and discriminatory ability. High-quality studies have established that early identification and treatment of hip displacement in children with cerebral palsy through hip surveillance can dramatically reduce the number of painful neuromuscular hip dislocations. All hip surveillance guidelines recommend early identification of hip displacement by quantifying each hip's migration percentage, or MP, on a pelvis radiograph. An MP greater than 30% has been established as a trigger for referral to a specialty center, since the risk of subsequent displacement is substantially increased when the MP crosses this threshold. Unfortunately, substantial barriers to the implementation of hip surveillance exist, including lack of education, lack of clear responsibility delineation, and challenges in the acquisition and interpretation of pelvis radiographs. To overcome these barriers and empower providers, we created a free mobile app called HipScreen in 2016, which has easily navigable menus for the understanding of hip surveillance guidelines, protocols for positioning of radiographs, and a validated tool for the measurement of MP directly from the device's screen. HipScreen was awarded the American Academy for Cerebral Palsy and Developmental Medicine's 2016 Fred P. Sage Award, and is distributed as a public service by Shriners Children's at no cost, without tracking or data sharing, and free of advertisements. The goal of this prospective study was to determine the accuracy and reliability of HipScreen to measure the migration percentage on hip surveillance radiographs in a diverse group of users. 37 HipScreen users participated in the study. 30 of the subjects were health professionals, and 15 could be described as experts in radiographic interpretation since they reviewed X-rays as a regular part of their clinical practice. None of the participants had previous familiarity with the HipScreen app. All the participants took a standardized online training for HipScreen and scored at least 80% on a competency test. The online training program and test are included as references and supplements to this manuscript. The participants then measured the migration percentage of 40 hips on 20 apipelvis radiographs using HipScreen loaded on their personal mobile device. They did so at 2 time points separated by at least 1 month. The mean absolute error of the HipScreen app measurement and the reference standard was calculated, with the reference standard being the migration percentage measured on a radiology workstation. We also calculated the intra-class correlation coefficient to assess reliability. With the positive case considered as a migration percentage greater than 30%, we calculated the receiver operating characteristic to determine the HipScreen app's discriminatory ability. Our findings were very encouraging. The mean absolute error among participants was 5.72%, which is considered clinically acceptable, with an even better accuracy found in physicians and healthcare professionals. The HipScreen app measurement had an excellent reliability with the intra-class correlation coefficient of 0.83. It had excellent discriminatory ability with an area under the receiver operating characteristic of 0.92 and a sensitivity of 94%. We conclude that the HipScreen app has excellent accuracy, reliability, and discriminatory ability in a broad range of users and can be used as a valuable point-of-care tool to assess hip displacement in children with CP. We hope that you find our study and the HipScreen app useful. Thank you.